Come in.
Hi, Miss McGurr.
Hi.
My name's Cowen. I'm going to be your nurse today.
Okay.
What brings you to the office?
Just a normal checkup.
Wonderful. Give me just 1 minute. I'm going to take a quick moment to wash my hands, and I'll be right back.
Okay.
So, tell me about your health over the past year.
It's been good.
Any concerns?
No?
Have you been sick at all this season?
No?
Have you got your flu shot?
Yes.
Wonderful. So for today's health exam, we're going to focus on 5 major areas: your skin, your heart, your lungs, your blood vessels, and your abdomen.
Okay.
So just by looking at you, I'm assessing your skin. It looks to be a good color.
Good.
I'm kind of inspecting for any rashes, any lesions. Do you have any areas of hyperpigmentation that concern you?
No?
Very good. Now lift your arms. Look on both sides. Assessing your skin is very important. You even want to take a mirror and kind of look at the areas that you can't see yourself. And take a look at your neck. Wonderful. Your hair also looks very nice and thick. Well moisturized and healthy. That's a good sign as well. Good nutrition and overall good health. Do you mind pulling up your pant legs just so I can take a look at the skin on your legs?
Sure.
Very good. Your skin also looks healthy on your legs. I don't see any lesions, any areas of hyperpigmentation. I'm going to touch your skin on your arms. That gives me a good idea of your skin temperature. Good. Nice equal temperature, warm, well perfused. That means you have good circulation by your heart and your blood vessels. Great. So when we're assessing the skin, I'm always looking for cancerous spots. We talk about the ABCDEs of melanoma, which is just another word for cancer. So when we're looking at any areas of concern, you want to talk about asymmetry, if it looks the same on both sides, the color of it, the border of it, the circumference of it, the diameter of it, and the evolution of it, if it's changed any at all. So you said you didn't have any areas of concern on your skin?
No.
It looks like you have good, healthy skin to me as well. So we'll go ahead and move on to your heart exam. To do so, I'm going to have you get comfortable over here. So Miss McGurr, when we talk about heart health, it really just starts by looking at your chest. Your chest is what we call the pericardium. I'm making sure that it's symmetrical. There's no swelling on the left side. That would indicate that your heart is larger than a normal size. So just by the looks of it, your heart health is good. The next step is to take a quick palpation of your apical pulse. I do so by placing my hand over your chest. I'll do so now with your permission. And I feel your apical pulse. It's good, strong, with a regular rhythm and a normal rate. Now to feel for your point of maximal impulse. You can feel it on about half of normal adults, so if I can't feel it, that's okay too. It's about at your 5th rib space on your left side, so I'm going to count your ribs and kind of feel for that now.
Okay.
Okay, so I have my fingers here. And I do feel your heart at your point of maximal impulse. Nice, strong, and regular. I don't feel any abnormal lifts or heaves or thrills. That would indicate turbulent flow or problems with your valves or holes in your heart. So that's good so far. Next, I'm going to take a quick listen. There's 5 areas of your heart that I'm going to listen to. I'll kind of talk you through them as I do. They include your valves as well. I'm listening for kind of crisp, clear sounds, making sure that there's no murmurs. If I do hear a murmur, that's kind of the turbulent blood flow that we talked about before. And that would be indicative of some narrowing of your valves or some leaking of blood backwards through the valves. Okay?
Okay.
Your second intercostal space on your right side is where your apical pulse is. Your aortic valve sounds great. I'll move on to your pulmonic valve. That's your second intercostal space on your left side. Pulmonic valve sounds good. Erb's point is right below it. Your fourth intercostal space is going to be your tricuspid valve. Nice, crisp and clear, no murmurs. And your fifth intercostal space is your mitral valve. Also nice, crisp, and no murmurs. Now just listening to your heartbeat. Your S1 and S2 are strong, clear, without murmurs. I don't hear any rubs, clicks. Very good.
Yeah.
So I consider you in good cardiac health overall. We'll move on to the assessment of your lungs. Just by looking at you breathing, I'm starting to assess your lungs right now. Looks like you're comfortable breathing. You're not having any trouble.
Mm-mm.
Your chest is rising and falling symmetrically. You're not breathing too fast. And I don't see any signs of labored breathing. I'm going to have you just sit up where you're at so I can palpate and make sure there's no masses around your lungs.
Okay.
So just stay where you're at. I don't feel any masses. That's very good. Just to make sure that when you breathe deep, your lungs are expanding symmetrically, I'm going to place my thumbs along your spine where your ribs meet. This is your costovertebral angle. And just take a deep breath. Very good. My hands kind of moved out symmetrically, and that means that your lung volumes are nice and big, deep lung breaths, and they're symmetrical. The next thing I'm going to have you do is just repeat 99 over and over again.
99, 99, 99, 99.
Okay, that was perfect. I felt the vibrations from the 99 equally on both sides, and it was a little stronger up top than the bottom, and that's normal. The next thing I'm going to do is listen. I want to listen directly on your skin, so with your permission, I'll roll up your shirt a little in the back.
Okay.
And if I can grab this drape here, I'll just make sure that you're covered so you're comfortable. Just going to roll it up to about your breast line or your bra line. And give it a quick tuck. And here as well, just around you. Okay. I do need to listen directly on the skin. Deep breaths. Now breathe normally. And deep breath. And again. Very good. I'm going to have you say a couple things, and I'm really checking to make sure you don't have pneumonia or any severe congestion. The first thing I'm going to have you say is 99 again. You'll wait till my stethoscope's on your back. And start.
99, 99, 99, 99, 99, 99.
Very good. Now I'm going to have you say E.
E, 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 E.
Very good. Now if you can whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
lung sounds nice and clear. All of those things that you were saying were appropriately kind of muffled for me. If they were too loud, I would be concerned for pneumonia or some sort of congestion. But it seems like you're good in terms of lung health. Now I'm going to do some percussion. It's kind of the same thing if you'll stay sitting up. I'm just going to make sure that both sides are sounding the same. No masses. And your tissue sounds equally dense. And I didn't hear any crackles or wheezes or rhonchi, so that kind of completes your lung exam. The next we'll go to your blood vessel exam and your vasculature. If you don't mind laying down for me one more time. It starts just by looking at 2 blood vessels in your neck. Your carotid artery runs underneath your chin, and your external jugular vein runs kind of lateral on the side of your neck. I'm just looking at them now. I don't see any abnormal pulsations. I don't see any distension of your external jugular vein. That can happen if you are fluid overloaded or if you have heart failure. And especially when you're laying down, it's more pronounced. But I don't see any, and that's normal. The next I'm going to do is some light carotid palpation. Just feeling for your pulse. Making sure there's no bruit, which would indicate stenosis and kind of turbulent blood flow. Your pulse is nice and strong. Now I'm going to palpate the other arteries in your body, starting with your brachial artery is kind of on your bicep, moving on to your radial artery on your wrist, then for your popliteal artery behind your knee, and then a couple arteries on your feet, okay?
Okay.
You're going to feel me do both sides at the same time so I can compare and just make sure they're equally strong. So feeling for your brachial artery, nice and strong and equal. Radial artery, good and strong and equal. I'm going to roll up your pant legs.
That's okay.
Okay, so your popliteal artery is going to be right behind your knees. Both popliteal arteries, nice and strong. Your dorsalis pedis and your posterior tib. Great. That's it for your blood vessel exam. All your arteries seem to have nice equal perfusion and they're good and strong and regular.
All right.
Thank you so much. The last portion of your exam is your abdominal exam. To do this, I'm going to drape your lower half. I'm going to ask you to kind of roll back up your shirt just to your bra line. Do a little tuck. As always, I start by taking a look. Your abdomen is a nice normal shape, normal contour, no protrusions, no abnormal pulsations. Next thing I'll do is take a listen. Just want to make sure your bowel sounds are moving nice and regularly. I'll listen in all 4 quadrants. Good movement. Nice and active. I'm going to take a quick listen to the blood vessels that also run through your abdomen. Your aorta runs right down the middle, and then you have a right renal artery and a left renal artery that we'll be taking a listen to as well. So here's where your aorta is. Nice, strong, regular. No bruit. Right renal artery and your left renal artery. Very good. I'm going to do some palpation, which is just when I press on your stomach. We'll start off nice and light, and then it'll move a little deeper toward the end, okay?
Okay.
If you feel any pain at any time or tenderness, let me know, because that would be abnormal.
Okay.
Start off nice and light. Any tenderness?
Nope.
Wonderful. I'll do a little deeper. Very good. No tenderness there either?
Nope.
Now I'm going to try and feel if I can palpate your liver. To do so, I have to place my hand behind the right side of your ribs in the back and kind of lift you forward some, okay?
Okay.
Here's my hand. I'm going to lift you up. I'm going to try and find that liver border. And it's right about there. And that's kind of normal where it falls. I'm also going to try and palpate your spleen. A lot of times your spleen hides underneath your rib cage, so I may not be able to palpate it. But I'm going to ask you to take a deep breath on this side while I try, okay?
Okay.
So my hand's going to go behind your back. I'm going to lift you up. I want you to take a deep breath and exhale. I wasn't able to palpate your spleen, but like I said, that's normal even if you can't find it. At least that means it's not too large. The last thing I'm going to palpate is your kidneys. I'll have you roll side to side for that. If you roll to the right first, I'm going to feel both sides. Feeling a little deeper for those kidneys. No pain?
No.
Very good. No pain is really kind of what I'm looking for. If there were to be pain, then I would kind of be suspicious for some kidney stones or some kidney inflammation. How about this side? Any pain?
Nope.
Very good. You can go ahead and lie on your back again. And I'm just going to do some palpation of your aorta by placing my hand on either side of where that blood vessel runs. And making sure I don't feel palpitations on either side. So I'm not suspicious for any aneurysms or any abnormal parts of the vessel. That's great. The next part is to percuss. So percussing is when I kind of tap on it like I did on your back to listen to your lungs. We're going to make sure that we hear kind of the same sound throughout your 4 quadrants of your stomach. Perfect. That was all nice and equal. Now I'm going to try and find your liver border. To do so, I kind of have to start up high on your right side, about where your lungs are. Oh, I think we found it already. Do you hear the difference?
Mm-hmm.
That's lung, and there's the top of your liver. We're going to find the bottom of your liver by just working our way up from your umbilicus. Oh, it's right about there. So if we were to mark both sides, your liver border looks to be a normal size. That means it's between 6 to 12 centimeters, and it is. I'm going to try and percuss to find your spleen on the other side. If it is hiding underneath your ribs, which from my palpation I believe it is, we might not hear it. So that's normal. So and there's your ribs. So I wasn't able to percuss your spleen, but that's okay. We're going to move on to percussing your kidneys. So if you can just take a seat up for me, and you can roll your shirt back down. I'm going to put my hand over your kidney in the back. Tell me if you feel any pain on the count of 3. 1, 2, 3.
No.
We'll do your other kidney on the count of 3.
No.
Very good. Like I said, if you were having kidney pain, we could kind of work that up. But since that was all comfortable for you, no tenderness, no pain at all,
No.
we'll consider that a normal health exam. That really concludes our part for today. Did you have any more questions that I could help you answer?
No.
Wonderful. Well, I'll let you finish getting comfortable, and I'll meet you at the front desk.
Okay, thank you.
Thanks so much. Have a great day.
You too.